to talk briefly about medical equipment and technology. So when we think about our children and youth with medical complexity, thinking about all the different aspects of their care or their lives. So thinking about whether we might have a child or youth that might have some cognitive challenges, they might have intellectual disabilities. So helping to understand how we communicate to them. They might have some visual challenges or auditory. They might have be deaf or hard of hearing. They might have some physical disabilities that might preclude them from evacuating. So maybe they need to be carried down the stairs. Maybe you can't use typical smoke alarms. They might need lights. There are smoke alarms that have flashing lights. You're going to hear from a colleague and friend Guy Triano from the Red Cross, who actually I've learned over the last couple of years, they make shaker bed alarms so that the bed will shake, and he can explain those to you. But there's lots of different ways that we can adapt. But a lot of that comes from understanding and really taking the time to know. It could also be speech and communication, so that a youth or child might not be able to tell us what they're feeling, but having some understanding of where they are, and just meeting them and their family where they are, and understanding is really what it's all about. So again, thinking about this evacuation, and this comes from Dr. Chernek's toolkit, but just really want to think about, as we've been doing this home assessment project, one of the things that, we are recognizing is that lots of families don't have stair glides, or, getting out in an emergency. They're not necessarily going to be able to do that as easily or as readily as maybe other families, or maybe we haven't even thought about it. So again, getting at the upstream, being prepared. And so thinking about the equipment and power, this is something that's really come up a lot in a lot of our work. So I can tell you, personally, as a medical provider, one of the things I've been trying to get better at is when I have children and families that might be using a feeding tube or oxygen at home, thinking about what to do when power is out. Some of that it comes down to ordering the right supplies, making sure families know how to use a syringe to feed their child with a gastrostomy tube. So thinking about, how you can notify your local companies, thinking about settings, making sure, you have a backup ventilator and, generators. And, sometimes I've learned over the years that we can't assume that all insurance companies or medical equipment providers or medical providers or families know, to have some of these things ordered, to have them in the house, to have them charged, thinking about car chargers, thinking about batteries, thinking about, having on that care plan, that equipment provider. And just so some of these components, again, all coming back to that upstream, being prepared and working together across the whole care team for that child and that youth.